Rapid hair loss, shortness of breath and the feeling of the body shutting down. They're all symptoms to be taken very seriously.
Headaches, rashes, even heart attacks. Thousands of women claim their breast implants are making them sick.
So your date of birth?
10/22/91.
And what type of surgery are you having?
I'm having a breast implant explant removal. Bilateral something, she said it, like all fancy, but you get it.
Yeah. All right, and now I just need a couple of your health questions, okay? Does your blood pressure normally run slow? Okay.
That was actually like really painless. All right, let's do it. Hi.
Hello.
How are you?
I'm wonderful. Good to see you.
Ew.
All right.
Do it.
Let's do this.
Okay, we walk through this hallway. Becky?
All right, so we're now in the examination room. We're just gonna kind of take a quick look again, go over the surgical process, okay, kind of go over the exact plan that we're gonna do for you. We'll talk about some of the things you need to do before surgery. We're about a week and a half before surgery, and then some of the post-operative things that we have to do for you in care, okay? And then we'll go through some timelines, and then we will go through the paperwork and all that and take it from there.
I'm gonna move this.
Okay.
Mic.
Okay. So here we have our breasts. So the biggest issue here is this left breast. Okay. And so if you feel, you can see it's almost a rock. This thing is not really moving at all. This whole thing is just in there. Yeah. It's not moving with the breast. It just moves within the breast. We have a little bit here. So this is what we call a grade 4. Like I mentioned before, there's 4 different levels of capsular contracture. You have what we call a grade 4, which is the highest.
Ooh.
So that means displacement, pain, and this tightness. So you have basically all 3.
So uncomfortable.
So uncomfortable. So this one is probably also a 4 because you are having pain on this side as well. Anytime there's pain, that's already automatically the highest level. This one isn't quite as bad, but you can see the nipples, just looking at the stickers, are a bit off, right? This one's kind of a little bit lower. This one's a little bit higher. And that has to do with some of the capsule that's inside.
Yeah,
Okay?
and then also when I move this arm, if I work out upper body, it's over. I'm in pain for so long, and I have a picture that I'll include into the video. My boob was up here, and I'll show it to you, and it was also going into my armpit. It was so swollen, so I stopped doing arms or chest workouts because I can't do it.
After this, you're going to be able to do all that without any pain, discomfort, and you're just going to feel...
I have like the best arms, and I'll probably get my abs back too.
Perfect. The biggest thing you're going to notice is that range of motion, and that tightness is just going to be gone kind of right away. So you'll feel great, okay? So basically, we'll go through the same incision, through the areola, your old areolar incision. Okay. We're going to go in, we're going to take the capsule of the implant out in one chunk. It's called an en bloc, okay? So we take it out in one chunk so you can see. It's almost like I said, like an orange, exactly, and it's kind of red and orangish as well. So we'll do that, and then we'll put drains in there. Okay. So the thing to understand, like I mentioned before, is the biggest, probably highest risk of complication here is something called a hematoma, kind of like you had before with the other surgeon, because there's a lot of dissecting and a lot of cutting of the tissue. There's a lot of blood vessels, right? And so there's going to be a lot of bleeding and oozing of tissues. So what the drains do, 2 things. Number 1, it takes out all the extra fluid. But number 2, at the same time, you have empty space now there, right? So imagine like when a balloon deflates, there's a lot of empty space and the skin's just kind of blah, right? And so what the drain does is it creates negative pressure. So the negative pressure not only pulls out the fluid, but also collapses the space. Oh, that's good. So as the space collapses, now you have tissue on tissue healing together, and it'll prevent seromas or air pockets or things like that. So it'll heal a little bit quicker for you. Okay?
Oh, good.
So those are basically 2 reasons for the drain.
So there was a person who I looked on their Instagram. They had an explant as well. They said that they had to log the draining.
That's correct. So the reason for that is your body can only absorb so much fluid. Okay, so that's another reason for the drain. your body can absorb about 20 to 30 cc's of fluid as far as the breast is concerned. And so if you're draining 100 cc's, and cc's are milliliters, that's just a medical term. So basically, if you're draining 50, 60 milliliters and your body can only absorb, let's say 30, right? You have 30 that's just sloshing around in there. And you don't want all that fluid sloshing around and so on and so forth. So you log it because as each day progresses, it should be less and less and less and less. And once it gets to a lower threshold to where your body can kind of just absorb the fluid that's coming out, then we take the drains out.
Okay.
So that's the reason you log it. Exactly
Well,
correct.
typically, how long would you say the drains are?
Usually about a week, within about a week. Sometimes a little longer, but usually within about a week, we should be able to take it out. Again, with a lot of medical technology these days, things are improving. There's actually something I started doing, and this is actually within the past maybe 3 or 4 months. So very, very new, yeah. They used to do it in the orthopedic field, but it's recently become huge in the plastic surgery field. During anesthesia, we'll be giving you something called TXA. It basically prevents the blood clots that happen from breaking down. And so that, long story short, causes less bleeding over time, less fluid, less bruising, things like that. So hopefully the drains will come out a lot quicker.
Oh, nice.
So that's something that's been new in the plastic surgery literature within the past few months. It's been in the orthopedic literature for years, but it's something new that we've been doing in here. So advancements in technology, advancements in technology.
And then, so in the pre-op orders, it says no aspirin, no ibuprofen.
Exactly.
No
So
fish oil.
the two biggest things here from a preoperative standpoint, so we have a week and a half. So we want to stop all blood thinners.
Yeah.
Okay. So the most important thing to understand is a lot of patients don't understand Advil, Aleve, these are all blood thinners. Okay. The only thing you can take if you have headaches, little cramps, migraines, things like that is Tylenol. So extra strength Tylenol you can take even up to surgery. Anything else I would avoid. So Excedrin, Motrin, ibuprofen, Aleve, all those things can tend to make you bleed a little bit more. So avoid all those things. Okay.
I'm done.
Number one. As far as vitamins go, vitamins, herbs, fish oil tends to thin the blood a little bit as well. So just want to make sure you don't take fish oil. If it's within the regular multivitamin, that's okay. That's just such a small dose, but I just wouldn't do the extra fish, the extra fish oil capsule. Okay. So that's the one big thing. The second big thing is nicotine. Okay. So we want to avoid nicotine from here until surgery. No nicotine. A lot of young patients are doing vapes. So understand vapes, there's nicotine in vapes as well. It's a huge, huge thing out now. Okay.
I don't do any of that.
Great. So, when it comes to smoking and nicotine, to each their own. I'm not here to be a parent and tell you what to do and know what not to do. That's to you.
Don't smoke vapes.
But from a surgical standpoint, nicotine has shown to decrease blood flow to the small capillaries, especially to the skin. And so it inhibits wound healing. So it's very, very important to stop any nicotine. So that means patches, that means gum, that also, and secondhand smoke, that all is involved. Exactly. Cigarettes, all those types of things. So, a couple weeks before, a couple weeks afterwards. If you want to get back on it, fine, to each their own. But from a surgical standpoint, from healing complications and things like that, you want to stop. Okay. So those are the two big things. Oftentimes I get asked, what kind of diet should I be on? What kind of this and that should I be on? You don't have to be on a certain diet. Okay. I would say, obviously, the healthier you are, like we talked about before, the more optimize your health is, the better you're going to heal, right? So obviously you want to be healthy. So try to eat some healthy foods, make sure you get your vitamins in and make sure your health is as, tanked up as possible. Yeah. Make that tank as full as possible so that after surgery, you're not going to be eating quite as much, right? You're going to be nauseous a little bit. You're probably not getting the right nutrition in and things like that. So your body is going to be tanked a little bit. So you want to make sure you're optimized to make sure that when you do tank after surgery that you're prepared for that.
Well, okay.
Yeah. The biggest thing is just no eating or drinking 8 hours before surgery.
Right.
Okay. So most patients just do after midnight, don't do anything. And by the time you come in for surgery, you'll be fine. The good thing is you're the first person for the day, so you don't have to worry. Yeah. So patients that are like more in the afternoon, you have to do more calculation. Like, okay, maybe like 6 a.m. If your surgery's at 2 p.m. I guess, right? So.
I think I'm gonna have so much like excitement, anxiety, like we're not anxiety, but like anxious energy that I won't even be hungry. I'm just gonna be like.
That's good. Yeah.
Let's do this.
So you can brush your teeth in the morning, wash your face if you like, but just make sure you don't have any coffee. Make sure you don't drink any liquids and things like that.
And then it also says don't wear deodorant.
Yes, that's only because, especially with here, if you have chemicals on your armpits, because the biggest thing here, we want to prevent infections and things like that, right? And so because it's close to the breast area, we want to make sure you don't have any residual chemicals or powders or anything like that
Yeah.
in the area. So we'll make sure it's clean as possible. We're always going to wipe you down and things like that, but
Yeah. Can I bring
sterilize
it
it.
for afterwards so that my breast doesn't, my body doesn't stink?
If you want to, sure, absolutely, yeah.
Okay.
I think you'll be fine though.
I know.
We're literally going to, so we basically sterilize you. So when you when you go in, we clean everything up. There's this chemical that we wipe on you, and that basically kills all the germs and bacteria and things like that. So like it's a sterilized field, and you'll also see this. I mean, you won't see it, but afterwards, we put a bunch of blue drapes in everywhere to make sure everything is sterilized. So the drapes are sterilized, your body's sterilized, so everything in that area is as clean as possible.
Okay, great. All right. I'm nervous and I'm ready.
So that's the pre-operative stuff. Not too much other than those two things to avoid.
Alcohol.
Alcohol, yes, you're right. Forgot to mention alcohol. So usually, if I always tell patients a week before and a week afterwards. If it's like 3 or 4 days, fine. But just to be on the safe side, a week before, a week afterwards. The reason for that is alcohol can tend to thin the blood.
Mm-hmm.
If it thins the blood, you tend to bleed more. Chances of
Right.
hematoma are higher. Things like that. So you want to avoid the alcohol. Okay. So that's a pre-operative portion of it. The surgery we kind of already just talked about. So let's talk about aftercare. Okay. So the biggest thing here is, like I said, the first couple of days obviously is going to be a little bit uncomfortable, right? With the anesthesia and all that kind of stuff. I generally tell patients for the first meal, because you're probably going to be hungry afterwards, right? The first meal, I guess so to say, I generally recommend shakes, smoothies, something light. Because the anesthesia that you're going to have, and first of all, you're fully asleep. So it's called general anesthesia. You're fully asleep. This is going to be like a 5-second procedure for you. A bit longer for me, but you go to sleep, you wake up, and you're done. So because of the medications from the anesthesia, you're going to be a little bit loopy, kind of a little bit out of it, and very nauseous. So one of the medications we're going to give you is anti-nausea medication. Okay. So.
Nauseous.
And so the first meal, I generally like to recommend smoothies, shakes, something easy. We want to make sure you can get it down. Okay. Once you can tolerate that, then we can move on to like salads, soups, rice, potatoes, things like that. And if you can tolerate that, then you're good to go. So there's really no dietary restrictions afterwards. We just don't want you jumping in, full force to a hamburger, because if that makes you nauseous and you're throwing up, it's not good either, right? You should be back to doing all your normal daily routine activities. So, taking care of your little boy. Exactly. You're doing some chores around the house, maybe, running a couple errands here and there, okay? It might be a little more difficult for you because you do have those drains in. Not that you couldn't do it, but it's just kind of annoying. It's hard to move your arm around when you have something sticking out of the armpit. Okay?
Is it going into the armpit?
It's coming right out of the armpit right now. Yeah. So it's more annoying than anything. It's just kind of right in the way there.
Crazy. Okay, so I bought a robe that has pockets for the drains.
Oh.
I was
Look
on
at you.
Instagram, not on Instagram, I was on Amazon, and I'm like, because people get mastectomies, right?
Yeah.
Most breast cancer.
Very similar. Okay.
Similar. So in the sense of like the drains, similar what you would wear. Post, I even has like buttons and zippers.
You're very prepared. That's good.
Yes,
That's good.
I did.
That's good.
I bought like a bunch of different zippered tops and tube tops that are easy to get on.
Good.
Just look at when I'm able to.
Yeah, yeah.
Because,
Perfect.
Yeah.
Perfect.
I'm really.
You're very well prepared.
Yeah.
And then, like I said, around a week, maybe even less than a week. Hopefully, it's less than a week because of, again, the new medications and stuff that we're going to be giving you. And as you chart it, as long as it's below, like I said, about 25 or so for maybe 2 or 3 days in a row, you come in, we'll pull the drains out, and you're done. Okay. So I would say about a week, you should be back to, once the drains come out, and around a week or so, you're pretty much back to doing everything you're doing before. Yeah. Okay.
Well, I'm ready.
That's basically it. And we'll talk about scar cream therapy. We'll talk about some of these other things once we hit about a month. Okay. No, two big thing. No soaking, the hot tub pool jacuzzis. We don't want, dirty water going into the incision. We want to make sure the incision's healed. But you can shower about 2 days after surgery. So we'll leave everything alone for about 2 or 3 days. You can shower. I know the drains are in place. You can shower over them. It's fine. No big deal. I
got drain caps. So I got the little shower caps.
You're prepared. Yeah, you're definitely prepared. Yeah. So as long as you're not taking a bath, so as long as you're not soaking, running water, you're fine.
Okay.
And I don't care what kind of soap or conditioner, anything that you want to use, you're more than welcome to do.
Perfect.
Okay.
So I'll shower on Thursday night, have a big meal Thursday night, wake up Friday, fresh and ready to come, and then I'll eat later on after that. Okay, cool. I'm excited. Thank you.
So that's